They were meant to be among the first to be immunised against COVID-19, but health and care workers are being left behind in efforts to vaccinate the world, according to the International Council of Nurses. New figures suggest tens of millions of frontline workers have yet to be fully vaccinated worldwide. Our global health correspondent, Juliet Mazender, reports.
Ever since this outbreak began, health and care workers have been putting their lives on the line to protect ours. The world was caught woefully unprepared for COVID-19.
We've had doctors tell us that they feel like lambs to the slaughter.
Protective equipment was in short supply. Some were reduced to using bin liners as barriers against the virus. Now, more than a year on, as vaccines are rolled out around the world, tens of millions of those working on the COVID front line still haven't received a single vaccine dose.
You've got nurses and healthcare workers going to work knowing that there is a way to protect them, and nurses and health workers in other countries are getting that. People who are less vulnerable in other countries are getting that as well, but they are being left behind. It feels that despite all of the warm words of support, they in some way are dispensable or disposable.
Many countries are not officially reporting the number of health and care workers who have died of COVID, but the World Health Organization estimates it's at least 115,000. That's around 200 deaths a day, though it says the true figure is likely to be much higher. And even though health and care workers were supposed to be prioritised for COVID jabs as soon as they became available, only 1 in 8 globally have been fully vaccinated, and the vast majority of them are in richer nations.
I had my first shot and currently waiting for my second dose. Things have been very, very difficult on our part because we have been short-staffed, and then the number of cases that we are receiving each and every single day is so overwhelming.
To see the suffering, to go physically through it again, the emotional impact again. At this moment, I feel most of us will not survive it mentally.
Healthcare workers around the world have staged protests about working conditions, pay and a lack of protection throughout this crisis. But there are concerns that governments may be reluctant to share the data of healthcare worker infections and deaths out of fear of facing legal action. COVID vaccines are in scarce supply, particularly in lower income countries. It's also these countries that tend to have precious few healthcare workers. The wider concern is that if they are not protected, then the communities they serve are also left more vulnerable. Juliet Mazender, BBC News.